Are you familiar with all the rules?
Yes.
When you're done with the specific area, you must say, "I'm ready to move on." Is that clear?
Yes.
Okay. This section will test your knowledge of indications and contraindications of massage and bodywork. Please state to all examiners 5 standard intake questions you would ask a new client. You already know your client's name, age, and address.
I would ask my client whether they have any pre-existing conditions or injuries, whether they're seeing any kind of medical practitioner, if there is any area on their body they would like me to avoid during the massage, if there is any area on their body that they would like me to focus on during the massage, and I would ask them to give me kind of a rundown of their daily routine and activities. Ready to move on.
Please state 3 additional questions you'd specifically state to a client with bursitis.
Okay, if you have bursitis, I would ask you where your bursitis is located. I would ask you how long you've had this condition, and if you are on any medication for bursitis. Ready to move on.
Name 1 technique that you might use for a client with bursitis.
Very light or gentle effleurage. If it's in the acute stage, it would most likely be contraindicated though. Ready to move on.
Name 1 consideration for a client with bursitis.
I would consider if they're comfortable in any particular position on the table during the massage. Ready to move on.
The previously mentioned pathology does not pertain to the remainder of the exam. Please identify 3 sites of caution or endangerment on the body.
The axilla or under the arm, the femoral triangle, and the popliteal fossa behind the knee. Ready to move on.
Using active range of motion, assess your client's ankle.
Okay, Velma, we're going to be doing a little bit of active range of motion, so I'm going to have you move your ankle joint. It can be either your left or your right. If you have any pain or discomfort while we're doing any of these actions, just tell me. We'll stop first and then tell me. Okay, so I'm going to have you lift your foot, and then I want you to point your toes down, and then point your toes to the ceiling. Then I want you to point your toes inwards, like that. Then point them outward using just your ankle, and then draw a circle, and then draw a circle the other way. Okay, ready to move on.
Now please explain your range of motion findings to your client.
When we were doing circumduction, which is when you were drawing a circle, I noticed that your range of motion was a little bit jagged. It wasn't smooth, so we'd probably look at that first. Ready to move on.
In this section, you will be demonstrating competency in your preferred modality, as well as client interaction. For the hands-on portion of the exam, she will be your first-time client. Please explain your modality to your client and instruct her how to prepare for this section.
Okay, Velma, we're going to be doing Swedish massage for the massage section. So it's really long, gliding, very relaxing, flowing strokes. The pressure can really vary from light to moderate to deep, just depending on your preference. As for instructions, I'm going to ask you to disrupt your level of comfort. Lie between the sheets on the table with your face in the face cradle, so face down. And then if you have any jewelry on, I'll just ask you to take it off. And I'll give you a few minutes to change. Ready?
You've indicated that you'll be demonstrating typical Swedish massage. You have 10 minutes for your session. So at the state boards, there's typically a 10-minute massage that would happen right now. As Velma, the client, is getting on the table, we're going to reduce this just for the purpose of demonstration to a 1-minute massage. What they're looking for at state is that you have good communication with the client. I often recommend checking in at least 3 times, and also that there's a beginning, middle, and end. This is not supposed to be a full body massage. And if you're doing Swedish, you don't have to demonstrate all techniques of the Swedish modality. You could get away with just doing effleurage and petrissage. Do what you would do naturally. Don't feel like you have to demonstrate deployment if you don't normally demonstrate deployment. Are you ready for us, Ms. Velma?
Yes.
Okay, excellent.
Would you like a bolster? No, thank you. Is it just the massage section?
Yes, you can begin.
All right, Velma. Is it all right if we begin?
Yes.
Okay, I'm just going to start out with some light compressions over the sheet. Is that pressure okay for you?
Mm-hmm.
We'll now move on to the next question. Using a breast drape, please drape your client for an abdominal massage.
Okay. Going to redrape you. And then I'm going to have you turn over on the table and scoot down so your head is well supported. Comfortable?
Mm-hmm.
Okay. Let's stand on that side if it's okay. For this portion of the massage, I'm going to be doing a breast drape, which just exposes your abdomen so that I can do a massage on it. This whole time you'll be covered, any breast tissue will be covered, and you'll feel very safe and secure with the draping. Is that okay?
Mm-hmm.
Okay. So I'm going to have you pinch the edge of the sheet and the towel for me. Oh, I'm sorry, actually, no, I'm just going to have you hold that for me. And I'm going to pinch the edge of the sheet and the towel. And then these will stay together, and I'm going to pull the blanket and the sheet down. Is that okay?
Mm-hmm.
Right, now I'm just going to expose your abdomen. And then I will just expose your clavicle. Do you feel safe and secure? Okay. Ready to move?
Now please redrape your client and remove the breast drape.
Okay. So now we're going to redrape you. Okay, now I'm going to hold the edge of the towel and the sheet together, and I'm going to replace the towel with the sheet again. Sorry about that. Ready to move on.
Demonstrate shaking of your client's tricep.
Back. And can I have this arm come under the blankets? Thank you. Okay. Ready to move on.
Shorten your client's palmaris longus.
So for this section of the massage, I'm just going to be, well, with the kinesiology, I'm going to be outlining muscles on your body. But through this part, I'm going to be shortening and lengthening muscles on your body for you. If you have any pain or discomfort with this, just let me know, okay? Okay, I'm going to tense this for you and then flex the wrist. Ready to move on.
Demonstrate on yourself a stretch for the flexor carpi ulnaris and explain to your client how to do the stretch.
Okay, so to flex, or excuse me, to stretch a muscle that's right here on your body, I'm going to have you grab the arm that you're going to be stretching, grab your fingers and pull down. An action that this muscle does is also ulnar deviation like this, so if you want to pull your thumb almost towards your arm like this, you'll feel a nice stretch right through here. If you have any pain or discomfort with that, stop and we'll find a different way to stretch it. Ready to move on.
We'll move on to test your knowledge of muscle location, attachment, and actions. Outlining must be done on undraped skin with the exception of pectoralis major and pectoralis minor, which must be outlined above the sheets. During outlining, you may verbalize your answers, but verbalization will not be recorded. Only the outlining will be stored. On your client, outline the pectoralis major and all of its attachments.
For this part of the massage, I'm going to be draping and re-draping.
Can I have you outline on this side
Yes.
of the table, please?
I'm going to just put it on and makes it a little warmer. I'm going to be draping and re-draping this part. I will be outlining muscles on your skin. Is that going to be okay with you?
Yes.
Okay, so for this muscle in particular, I won't be touching you because it is over breast tissue, but can I just see your arm? Yes, thank you. Okay. Ready to move on.
Name and demonstrate on your client the actions of the pectoralis major.
All of these actions occur at the shoulder. Flexion, extension to neutral, medial rotation, adduction, horizontal adduction. Ready to move on.
On your client, outline the extensor hallucis longus and all of its attachments.
Do you want your arm underneath the sheet again?
Sure.
Excuse me. Ready to move on.
Name and demonstrate on your client the actions of the extensor hallucis longus.
Extends the toe, the first toe, first digit. It dorsiflexes the ankle, and it assists with inversion of the ankle. Ready to move on.
On your client, outline the masseter, including all attachments.
For this particular muscle, I'm going to be outlining it on your face. Is that going to be okay with you?
Mhm.
Okay. So I'll just have you turn your head slightly. Thank you. Ready to move on.
Name and demonstrate on your client the actions of the masseter.
For this set of actions, I'm just going to ask you to open your jaw slightly and I'll close it gently for you, okay? All right, can you open? Elevates the mandible. Ready to move on.
On your client, outline the teres major and all of its attachments.
Okay, Vilma, I'm going to ask you to turn over again for me. So roll over and then put your face back in the face. Teres major.
On your client, outline the teres major and all of its attachments.
Ready to move on.
Can I have you outline that just one more time for me, please?
Ready to move on.
Name and demonstrate on your client the actions of the teres major.
All these actions occur at the shoulder. Medially rotates. Adducts. And extends the arm. Ready to move on.
On your client, outline the supraspinatus and all of its attachments.
Ready to move on.
Name and demonstrate on your client the actions of the supraspinatus.
All of these actions occur at the shoulder. Abducts and flexes the arm. Ready to move on.
The final section of the exam tests your post-treatment communication with your client. Please list the immediate and longer-lasting effects of a massage therapy session.
Velma, I'm going to have you turn over so I can communicate with you a little bit better. And I'll just have you roll over again. Okay, immediately after a massage, you may experience a little bit of lightheadedness. This is normal. You're just going to feel very relaxed. After the massage, a little bit longer, you may feel some soreness, kind of like you've worked out a little bit. This is also normal. You can stretch or ice if you feel the soreness is too great. Ready to move on.
Please list any post-treatment activities you recommend to a client.
I would definitely recommend that you drink a lot of water to rehydrate your body. Also, if you want to do some light stretching on areas that you feel need it, that is fine, and I can also show you stretchers that pertain to you as well. Ready to move on.
This concludes your practical exam.
Okay.
Good.